Welcome to the Birth Lounge podcast, an empowering space for expecting and new parents to hear candid conversations with experts, support your mental health, and learn the tips and tricks that thousands of parents have used to craft their ideal birth. We will answer all of your questions, the scary ones and the weird ones, to help calm your fears and feel confident going into your birth. I'm going to help you redefine what birth and motherhood looks like and how to embrace your journey. I've intentionally crafted a list of experts to help you navigate pregnancy, explore your birth options, and plan for postpartum so that it can be a time of soaking in your tiny human. We're going to go there on all the hard topics so that you can dive deep into finding your confidence and freeing yourself from fears around birth. With over 10 years of experience in family education and a master's degree in human development and family studies, I created this podcast as a way to share the resources parents need to make educated and informed decisions about their care in pregnancy and childbirth. This is a birth community driven by evidence-based information and research in hopes to help you explore your options, understand your rights, and know what choices you have along the way when it comes to birth and beyond. I'm your host, HeHe. Now let's get to the good stuff. Hi, before I dive into this episode, I wanted to make sure that you knew about my free guide to Pitocin use. It's a PDF download that breaks down everything that you need to know about Pitocin use. What does the FDA say about proper and safe use? How do we typically see it be used in American hospitals? If those two things differ, what kind of data do you need to be aware of in terms of the different uses of Pitocin? Where are some places in labor where Pitocin actually might be useful? How do you know if you're getting too much, too fast? How do you know what the hospital policy is, plus what are your other options, plus what you can say no to, plus what you can request? Well, it's all in the PDF guide, and that's totally free for you. So you can go to thebirthlounge.com/Pitocin. That's Pitocin, Pitocin, and download that. It's a comprehensive guide, got everything you need to know, plus how to have these conversations with your provider to make sure that your birth goals are met and respected during your labor. Again, you can find that at thebirthlounge.com/Pitocin. All right, now on to the episode. Hello, and welcome back to another episode of the Birth Lounge podcast. All right, you guys, we do a lot of talking about a birth plan and how to make one and when to make one and when to bring it to your doctor and how to bring up things that are important to you in your birth. But do you actually know the science behind making a birth plan? There is good data that says that people who make a birth plan actually do go on to have better births. You have better outcomes. You have a more positive experience. You experience less birth trauma. You have a reduced risk of unnecessary intervention. You have a reduced risk of C-section as well. There are so many benefits to having a birth plan. And I don't want you to think that, if you make a birth plan and you plan everything out, that everything's going to go that way. That actually is not part of it. What the data says, or what the data suggests, is that when making a birth plan, it's the act of doing the education, of reading up on your options, of exploring what different alternatives you have, of, kind of learning what will your choices be at each crossroad in labor or at each decision point that actually prepares you. It's not the physical birth plan. It's not writing it out. It's not printing it out and handing it to your doctor or having them, scan it into your notes or your chart. It's actually the work that is put into making the plan that transforms your birth. And that is partly because the more educated you are, the less likely you are to experience coercion or medical manipulation, and you are more likely to recognize when coercive care does pop up in your birth space, and you typically know how to get yourself out of that situation, how to advocate advocate for yourself, how to call it out, how to engage in that informed discussion so that you can have your goals met and you can make decisions that feel aligned with you and avoid making decisions out of, you know, fear or being pressured or, whatever it is. I'm obviously a big proponent of a birth plan. I talk about it all the time on social media. It's something I heavily teach inside the Birth Lounge membership, and there's an entire evidence based article dedicated to it inside the Birth Lounge app. So, of course, I'm so excited to have our guest, Dawn Hancock, or as you may know her, Nurse Dawn from Pivotal Birth, on today to discuss the critical aspects of creating a birth plan and the importance of effective communication with your medical staff during your labor and delivery experience. Nurse Dawn is a seasoned L&D nurse and a Lamaze certified childbirth educator and a certified lactation counselor and a board certified nurse coach. So she knows the good stuff, you guys. We met actually last year at the Leela maternity grand opening day. She was one of the nurses there, and it was just so much fun being able to hang out with her. And so I thought I'd have her on the show so that you can learn from someone who has seen hundreds and hundreds, thousands of births before, so that she can help you have the best birth possible. I know you're going to love her, you guys. Okay, without further ado, Nurse Dawn, welcome to the show.
Thank you so much for having me, HeHe.
Thanks for being here. I think that birth plans obviously are on everyone's mind, and used to, it was like taboo to make a birth plan. Now we've seen this wave of like, all right, everybody's making a birth plan. There is a portion of it that's don't make a birth plan that's inflexible, that you can't like accommodate or adjust as your birth unfolds. But I always get hung up on the taboo of handing your birth plan over to nurses, because I think that there's this idea, and we've seen stories online, that not all medical professionals are open to a birth plan. Sometimes it makes them feel challenged. Sometimes it makes them feel like, look, this person's definitely going to have a C-section. Sometimes it makes them feel like, oh my God, this person is so extra. Can you talk to us a little bit about what you've seen? Because you've worked in a couple of different hospitals. What have you seen in the hospitals in terms of receptivity of nurses and doctors to birth plans in the hospital? What's the point of making one if a nurse doesn't like it?
I think that's a great question. So, in my experience, I've worked in 5 hospitals in 4 different states, and only one of them I didn't do labor and delivery as a nurse. I did labor and delivery as a doula.
Ah.
So, and I have experience with home birth as well. So, I've explored all sorts of areas of birth, and it really is dependent on the nurse
Hmm.
and the doctor. It's not necessarily hospital specific, because there are some doctors and nurses who get their ego like bruised a bit when somebody brings in a birth plan. Like, you're going to tell me how to do my job? Do you tell your mechanic how to do their job? Like, kind of mentality.
Yeah.
But I think that the doctors and nurses who get their egos bruised don't realize how pivotal birth is to that family that is coming in there in that moment in time, and all the hours of research that they've put into making that birth plan. Very rarely do I see somebody come in with a birth plan that isn't well educated about birth itself, unless they might have had somebody else who had a birth plan like that and they just copied it. But that's
Um,
not super common. It's really common for people with a birth plan to actually have really done a lot of homework. The thing that I see oftentimes gives the nurses and doctors that mentality is if somebody comes in really rigid with their birth plan, like, this is
oh.
my birth plan and we have to do it this way, and they're not flexible about it, then that's where the angst comes from. And so then the doctors and nurses take that trauma experience into the next one that they see with the birth plan, and so on and so forth, because they haven't really realized, okay, this is just one person with a birth plan and it didn't end up well and they were super inflexible. And there may have been a near bad outcome or even a bad outcome because there wasn't flexibility,
Hmm.
right? And so, just like we see providers come in and treat patients a certain way because of traumatic things they've seen in the past, so they're using trauma-based care versus evidence-based care. That can be true with birth plans as well. So then they have this bias against birth plans and think that everybody that gives them a birth plan thinks like that one person that they had that
Oh.
experience with. Now, Obviously, this is how we are as humans. We have a bad experience with something, and then we just think all things in that category are the same. It's not, but
Yeah.
that's how we think because we categorize everything, right? And so I've seen doctors and midwives who are super excited that their patients have a birth plan, and nurses as well. And then I see some that are just against them. And
Yeah.
then the negative ones, they'll come and bring that birth plan to the nurse's station and be like, look, she just brought herself a ticket to the back into the OR to get a C-section because she made this birth plan. And that nurse and doctor that doesn't even realize that their bias that they just showed us all actually impacts the care that they give that patient and actually would possibly contribute to them ending up in the back. You see what
Yeah.
I'm saying? Yeah,
Definitely, it's going to impact not only the care they give, but possibly the outcome as well. And in a country that
absolutely.
we're already doing very poor in a lot of really important categories, we really have to be mindful about that. So, how do you, what's your advice to people to figure this out? You're in labor, you have your printed out birth plans. Are you having a discussion with your nurse to say, hey, we have this birth plan? If you don't love birth plans, we totally understand that, but we would request to have a nurse that really does love birth plans because this is important to us. Is that something you recommend maybe happening?
Absolutely. And even when you're getting admitted to labor and delivery, you can let them know,
Oh.
hey, we are a birth plan family. So if you're not a nurse that's super supportive of one, can you please let us speak to the charge nurse so she can assign us a nurse that is supportive of birth plans? Because unfortunately, the sad truth of the matter is here in the United States, anyway, not many labor and delivery nurse positions. Like when you finish nursing school and whether you've done another med surge or some other specialty or not, once you get to labor and delivery, there is very little formal training on labor support, birth plans, like how do we support somebody who's choosing not to have medication, pain medication for their birth? We don't get formal training on how to do those. So it's
Mm,
only if you are paired with a preceptor that knows those things, or you seek all that training outside the hospital on your own time and your own dime, are
really?
prepared. Yes. Now, there are
Wow.
some hospitals that are starting to teach some things or hiring people from outside the hospital to bring them in so their staff can get more trained on like the peanut balls and pelvic biomechanics and all these things that we are not taught as nurses in labor and delivery.
Totally. Totally.
Now, I don't want to discourage you or anybody listening because all the nurses in labor delivery are highly trained on emergencies. If you have a hemorrhage or if the
Definitely.
baby's heart rate drops, like we could do what we need to do to help you and the baby immediately. But as far as labor support and breastfeeding, those things for most nurses are done on their own time and their own dime. Now, some hospitals will reimburse that teaching, but not
Yeah.
all. Mhm.
Man, wow, that is so wild to me. These are the things that really irk me because they're the easy fixes. Hospitals typically have a ton of money. Don't even get me started on the rabbit hole of there's no money. Yes, there is. Invest
Yes.
in our nurses, right? Like really the bare minimum that you can do is provide every single nurse with a dollar amount and it needs to be used towards some sort of continuing education that they are passionate about. I've done
Mhm.
this with my team and I have found it to be very successful because people choose what they're passionate about and then they're passionate about it and it grows and it's wow, now you can serve our team in a very different way than you could before. And I just think that would
Yes.
make so many L&D units just flourish and people would have a new renewed sense of pride in their practice.
Yes, and a lot of hospitals, some like I worked at this one, it was so incredible. It was up near the Seattle area. And they not only, most hospitals will have that education money, but they don't tell you about it or push you to
Oh,
use it. They're like,
wow.
oh, it's here, but let's just you know, because then
Okay.
you might not, then you have to ask for the time off of work to go use that time. Like it can become very interesting to
Got it.
actually be able to use those benefits. But I've worked in one hospital before where they actually pushed you to make sure you used it every year. And then they would make sure you got the time off. So they really encouraged it. And then you did just education with staff to teach them what you learned.
Nice.
So it was all about shared learning and shared leadership. It was such a beautiful model. It was incredible. And I don't know how many hospitals in the US do that. I've only worked in one that was super supportive and really encouraging of you to do all those things.
Sure. Yeah.
Right. So
That's
they do exist.
yeah, it's comforting to know that they exist, but it's bummer that it's so sparse that most
Right.
hospitals are probably not doing that. Okay,
Right.
so your way of teaching people to make a birth plan is a little bit different than your traditional like birth plan preference sheet type thing. The mentality that you teach around it is a little bit different. Tell us about that.
Yes. And so this is new. We're just rolling this out because it's just been something really heavy on my heart. And it doesn't only work for birth. So that's really important. It can work for your own health, your child's health when you're seeking out care for them as well. But basically, what my recommendation is a pivot plan. Now, there are some people who think they can make a birth plan and bring it to the hospital, and here, that's it. That's my communication with my team, and that's it. Never rely on one piece of paper handed from one
Mm,
person to the next. You have to constantly be communicating with your team. And that's what the pivot plan is. It's establishing good, clear communication and expectations between you and your team so that when you go in to give birth, when the pivots change, because let's face it, birth is unpredictable. These babies have a mind of their own,
yeah.
literally. And they use them sometimes to totally side rail our whole plan, right?
Yep.
And it's nobody's fault. It's just the way it is. So with the pivot plan, we're talking all about these expectations and the way that you want communication to happen during your stay. So it's obviously going to be an acronym, pivot. And so the P stands for permission. You want your care team to get permission
Mm,
for what? For every test, every medication, every vital sign, every exam, like a cervical exam, every restriction, every time. So we know that I hear stories every single day. I'm sure you do too, where people are like, yeah, my nurse came in and gave me a medication. I didn't know she
oh
was starting
yeah.
the dose. What? That should A, never be happening
Never.
because you should be verifying all this stuff as a nurse every
Oof.
time. So
Oof.
the fact that happens just gets my goat because that nurse isn't practicing proper medicine, right?
Yeah.
And the fact that the culture of some hospitals allow that, that's just scary, especially when you think, I believe that medical errors are like the third leading cause of death
Death.
in the
Yeah,
country.
not like an oopsie, but oops, we actually
Yeah.
killed someone. Yeah.
Yeah. So every single time. So P stands for permission. You have to give them permission to restrict your food during labor. They can tell you it's not allowed, but you have to give your permission for that to be allowed. And if you don't give your permission, you just let them know, I understand that's the hospital's practice, but I am choosing not to do that. You can place it in my chart that I've chosen to
Oh,
eat,
nice.
even though you've shared the risks with me. It's
Perfect.
not a fight, it's not a battle, it's just communication, right?
Yep.
A nurse, and I was taught to do it this way. They come in and they say, I'm going to do a cervical exam. We're going to see where you're at. Not, okay, this is what we're seeing. This is our thought. Is it okay if I go ahead and do a cervical exam?
Mm-hmm.
You see
Mm-hmm.
what I'm saying? So by the
Mm-hmm.
time I left the bedside, that's my verbal communication with patients, but that's not what I was taught. And that's not what I was practicing most of my career because that wasn't the mentality of it. And
Yeah.
it breaks my heart to think of how many people did I go in and say, I'm going to check your cervix now, just because that's the norm. We
Yeah.
should get permission before we touch anybody, anytime.
Yeah. Yeah.
You know, the I for pivot stands for inclusion. I want to be included in the decision making during my stay for my birth experience, for our postpartum experience. Decisions shouldn't be made outside the room at the nurse's station before you come in. We want to understand and be included in that choice. V stands for values. My values are going to impact the choices that I make during my birth, during my stay, and please don't undermine or dismiss my values in the importance of my choices. They are a part of me and why I'm going to
Mm-hmm.
make the choices I'm going to make. O stands for options. Now, this one's interesting because some people want all the options.
Yeah.
They want the risks, they want the benefits, they want the alternatives, they want all the options. And some people just say, tell me what you would choose, doc. They
Mm,
just want to
yeah.
know. And so this one, just like permissions, you get to decide where do you want? Do you want all the options every time? Or do you want them to just come in and let you know what they recommend?
Oh, yeah.
So options, let them know specifically what you feel comfortable with. And then the T stands for time. I want time, time to make decisions. And I want time after my birth with you to debrief and before
Oh,
I discharge to debrief. I don't want to leave the hospital with any misunderstandings about my birth experience. And this is really important because debriefs can actually decrease the chances of any traumatic experience or perceived traumatic experience from turning into PTSD. Now, it's not going to prevent it, but
sure.
when we debrief and we talk about what happened, it shifts the way that our brain files stuff into our mind. And so then we have that opportunity to be like, you know what? Why did somebody choose to get on the bed and ride down the hall with me? You were having a cord prolapse, and this is what we
Hmm.
were doing. Now, hopefully, your nurses and your care team are going to explain what's happening to you in real time. But sometimes some nurses and providers aren't. We're just doing what we got to do because it's an emergency, and that's how we've been trained. We
Yeah.
forget to remember that you are experiencing this in real time.
Yeah.
So if we forget to say something, or if we forgot to say you're having a postpartum hemorrhage and we need to give you an injection, I've never forgotten to say, hey, we need to give you a shot in the thigh. Are you okay with that? But if somebody did, let's clear the air. If something happened and you didn't know why, can we talk about that so that you and your partner both have a better understanding of what happened? Because we know that partners go home, they deal with postpartum it, mood disorders afterwards as well, and they can have PTSD from what they've experienced their loved ones going through. So
Hmm.
if we have that debrief time with the families, even if we don't perceive any of it as being traumatic, it doesn't matter. It's what they perceived and what they
Yeah.
understood. And is there any misunderstandings here?
Yeah. Wow. That time to debrief, I think, is pivotal in and of itself. That is
Absolutely.
so freaking powerful. And you nailed it on
Yes.
the head of regardless of what happened, happy birth, great birth, and bad birth, terrible birth that was just like unexpected. So you're what happened birth, all of it, you should always be asking, like, I'd love to have some reserve time with you before I get discharged. Holy cow, I'm just having a
Yes.
mind blown
Right.
moment. Truly, yeah. That would be
It's
amazing. I also think time with your provider like that would decrease the risk of litigation as well, because we know that a lot of litigation is caused by patients having these unanswered questions and not having any sort of response, typically from the hospital or the hospital staff. Oh my goodness, this could be
yeah.
seriously pivotal in birth, in humans, in the hospital system, in our nation's stats. This is wild.
Yeah. Yes. And the when this was all coming to me, I literally sit in my backyard in the sun with no music or anything. And I just let things flow over me because if I'm trying to force something, my
It's
brain,
never gonna work. We are the
no.
same person. I love it. I love it
Yeah.
so much.
And so when it was, I have such a heavy heart for all the trauma that people are experiencing and all of the postpartum mood disorders. And we know, you know, as a doula, how much of it is avoidable. And
Totally.
one of the key factors to avoiding that trauma is communication. Because if
Mm,
that nurse is hopping up on that bed with you and putting her hand in the vaginal canal to hold the baby's head away from the cervix, and she's saying, hey, he, I need to do this. I am so sorry. Listen, this is what I'm doing. The baby's head is coming down, but before the head is the umbilical cord. And we have to hold the head away from the umbilical cord so their oxygenation doesn't get cut off. I'm
hmm.
going to be real up close with you right now until after delivery. We're going to take this ride together. What questions do you have?
Yeah. Oh,
That
you're gonna
nurse
make me
can't hold your
cry
hand.
because it's just so sweet and like I'm scared, but also I trust you. Thank you for keeping me in the loop. And I think about all the people who didn't have that experience and didn't have Nurse Dawn, and my heart breaks for them. I've
Right.
seen it, I've experienced it not as a patient, but as a doula. I've heard of people online, and I wish everyone had a Nurse Dawn.
Yeah. And my heart gets so heavy for these patients, and it's okay, but what do you do with the heavy? Well,
Yeah.
You can't take this heavy and hand it to somebody else and make things better for somebody else. But we
Yeah.
can improve the odds that you have better communications, less biases against you, and there's a lot of things we cannot do about bias in healthcare. And now, thankfully, the healthcare teams are getting more and more trained on implicit biases, the biases that they don't even know they have. And the thing is, we're just barely starting to unpeel that, right? So
Oh,
when they
yeah.
start to realize that, oh my gosh, I have a bias against birth planning, they don't even realize that's a bias. They don't comprehend it as a bias.
Wow.
And so we can't do anything against about a lot of those things. But if we can walk in there and say, okay, I chose not to do a birth plan or a birth preference list, but I did make a pivot plan, which is all about communicating with you and me and us. So that way I can make sure that you know what I need, I know what you need, and that there's no misunderstandings about what's going on. And so here, what do you think of this? And what should we add? Or what questions do you have?
Yeah,
Imagine setting such a neutral stage when you walk in to give birth. Now,
totally.
they're still going to ask you if you're planning to breastfeed or if you want a circumcision or vitamin K. They're still going to ask you your choices.
Sure.
But this is basically you giving them, I think, let me back up just a smidge. When we walk in with the birth plan and we say no induction, no Pitocin, no cesarean, no episiotomy, no, now nobody wants any of those
Sure.
or some of those, right? A lot of those we only do if they're medically necessary. But if you are handing that to a doctor or nurse, some nurses with the ego or doctors with the ego, they're thinking you're telling them how to do their job
Mm,
or that they don't have your best interest at heart. And so they just get this negative vibe, right?
sure.
But if we walk in talking about communication and how important that is to you. Now, I used to teach my birth plan class, and that's the one that's available now, where we talk about how communication should be at the top of your birth plan. This is what I want. This is the type of communication I want. And now for some people, they want to know every step when we're starting an IV. I'm washing it. I'm getting ready to start. I'm drawing blood. I'm taping you up. We're hooking you up. Da, da, da. Other people are like, please do not tell me what you're doing. Just do it. Like that communication is so important about what works for you because birth isn't the same for everyone and everything doesn't work. Everybody doesn't like the same stuff.
Yeah. So what would be some examples of things and like how would you display them or present them on a pivot plan for your preferences? I guess give us an example. So like on a birth plan, most people do have the things that you say, I prefer to have unmedicated birth, comma, will ask if I want an epidural. I prefer to labor upright. Please do not ask me to get on my back. What are we putting on a pivot plan that's a little bit different than that?
I love that. So I kind of look at the pivot plan like a cover letter
Got it.
to a resume. So you would still share your preferences like that. But honestly, the birth plan or preferences is way more. And I'm sure you've seen this as a doula. It's way more for the patient, her partner, and anybody else supporting her than it is
Totally.
for the nurses and doctors. Because
Totally.
you're going to be the one helping her to stay upright. You're going to be the one helping her to remember to get up and go to the bathroom every hour. Because with a full bladder, your contractions are more intense.
Yeah.
You see what
Yeah.
I'm saying? So that birth preference list is really more about you guys and how this is going to go. But having your preferences is still important. It's still helpful. But I like what you're sharing. Like, I'd prefer to be up and about and not giving birth on my back, those types of things.
Totally.
Also, with having the pivot plan, like a cover letter, what you're doing is you're setting that tone for communication. And you're going to be like, now, when you flip this page, I'd like to discuss any of these that you have questions about. Do you see what I'm
Yeah.
saying? Like,
Yeah.
open up that communication instead of saying, I don't want to give birth on my back. You could say, I'm really wanting to follow my body's urges and give birth that way.
Yeah.
Because for some people, even though they say that
Quote
they don't want,
unquote. Yeah. Yeah.
you see what I'm saying, they say they don't want to give birth on their back, but then they find that's where they're most comfortable.
Or
So it's
powerful. Yeah.
way more powerful for some people. Yeah, my
Yeah.
my daughter was like that with her second.
Oh,
She was like, I
yeah.
tried everything, even the stool. She's like, nothing felt right.
Yeah, sometimes you just need to be in that position, that curled around your baby position, and it seems counterintuitive after all we know about birth, but sometimes it just works. That's why you should trust that person and not do guided pushing, but that's another
Right.
conversation for another day.
And I think making sure our wording with our birth plans and preferences lists is important because what we're trying to convey are the things that are important to us, right? Ultimately. But I've seen birth plans as a nurse and I've seen them as a doula and I've seen them as an educator. I usually keep mine very basic, one side of one page.
Yep.
That's my preference, simply because sometimes the nurses won't have time to read them. And if they're in a busy hospital that's like a baby factory, they're going to have more than one patient
Hmm.
as a labor patient. And so
Yeah.
they can scan through it, making bold letters, the ones follow my body, make that bold. Don't make it too wordy because it's going to be a matter of if you've established this communication with your pivot plan at the front, that front page, and then that next page, minimal separation from the baby, following my body's urges, note different things like that. The things that your values want you to protect, those are the
Mhm.
things that need to be on there.
Mhm.
But
Mhm.
if they're communicating with all the other things with the pivot plan and they come in and say, hey, we want to take the baby to the nursery for the hearing screen, your values on that second page already have said, hey, we're the family that want the screening done here. They can say, oh, we don't usually do that. We understand that, but we aren't going to let the baby leave the room, or we'll come with to the nursery, whichever you
Hmm.
prefer. So it's
Sure.
not a fight. You can't take this baby unless I go with. You can do it in here, or we can come. Which would you prefer?
Yeah. It's almost like the strategies that you use with young toddlers, right? Is
Absolutely.
and it's that I don't say that to be demeaning in any way. I say
No.
that to say that we're teaching young toddlers communication skills, and I think medical staff have been taught different communication skills than what patients want, right? And so we are in a sense teaching these medical professionals how to communicate with us by our responses. So instead of teaching them to be defensive like they have been taught by medical school, teach them, like, oh, this family is safe. They're not going to get mad at me. They just aren't going to let their baby out of their sight. Would I rather them come to the nursery or bring the machine in here? Hmm. Okay, I'll do whatever feels best to me. I
Right.
think that's really pivotal too. Wow, you're on fire. This is just it. I mean,
It's
it really is like a ripple effect, right? It's once you get the ball rolling, you can have just like the best birth. But
yes.
you have to have those advocacy skills to be able to have these conversations and the education to be able to back that up and for you to feel
Right.
confident in advocating for yourself.
And you have to be able to feel comfortable enough to have the hard questions, right? So if
Yes.
they say, oh, no, parents are, oh, we can't bring the ear machine in here. It's not good for the machine for hearing, and parents aren't allowed in the nursery. It's against our policy. Can you show me that policy?
Oh,
I find that interesting that parents aren't allowed in the nursery
where their baby is being
where their
kept.
baby is. And
Yeah.
then I will come and do our hearing screen outpatient. But the hospitals get dinged if they let too many babies go without that hearing screen. So they're
Oh.
going to find a way to get
That
that
is
done.
very good to know. That's really
Yes.
good to know. Yeah, because my instinct was to just say, okay, that's fine. We'll have their pediatrician check. If you can't meet us where we're at, then we just will decline altogether. We have a pediatrician appointment anyway. And do that. Wow. Okay.
Yeah.
Can you show me that policy? What do you expect most nurses and doctors to say? Do you expect them to say, or do you expect them to say, yeah, absolutely, and then just not come back? Will they print it out and bring it to you?
I've never worked in a hospital that had a policy against the parents being in the nursery. In
Yeah.
my experience, 5 hospitals, 4 states. There's never been a policy like that.
Yeah.
Even if there are other babies in the room. So now, the only time I've seen where parents aren't allowed in the nursery, but they can come to the window is when it used to be, and I don't know what the hospitals are like in your area, but it used to be that the doctors would call and say, okay, I'm going to be there at 8 o'clock, have the babies ready. And we would bring all the babies in and line them up, and then the doctor would do it. Most hospitals don't even have a nursery that's staffed, so they can't even do that now.
Yep.
So that's, and second of all, those doctors need to be educating the parents during the assessment so that they know what to look for that's right. and normal. And if there's any concerns, they can teach the parents about that then and tell them what the follow-up is. You know what I'm saying? So now
Yeah,
it's
do you
very,
know what is on my mind? All the pediatricians that I have seen come in, zoom through, not say a word, sometimes not even introduce themselves, and adios, your baby looks great. Okay, goodbye. Let us know if you need anything. And I'm like, oh my goodness, that just can't be everything that you have to offer this family. If a family finds themselves in this situation, what would you say? Would you say that they just say, "Hi, would you mind explaining what is happening? Like what you're looking for in our baby, what kind of things you are evaluating right now?"
that is a great question for them to ask. And I definitely recommend dad stand up and watch the assessment. And if mom can sit or stand at the bedside too,
Yep.
say, oh my gosh, we've been so excited to watch you do this assessment. What is it that you're checking out right now? Will you let us know as you go
Nice.
along? Because
Yeah.
most doctors like to teach what they're doing,
Oh, good. Okay.
but usually they're teaching nurses or they're teaching somebody else. You know what I mean?
Yep.
Um, so a lot of providers will like to share what they know. Oh, we're
Mhm.
just checking the fontanelles and different things like that. But yes, I definitely recommend asking what, oh, will you just let me know what you're doing through this assessment? I'm so excited to watch it. Are you okay if I record it? How
Oh,
great would your baby like to see their very first assessment or whatever?
yeah, just special
It's
keepsakes. Yeah, that's
it's
fun.
so cool. And so I think that they would be willing to at least talk you through what they're doing. I always do as a nurse. I ask them if they want me to, if they want me to talk them through mom's assessment or baby's
Yep.
assessment, because a lot of people want to know what's normal and what we're looking at,
Yeah.
you know?
Wow. This is such a cool idea. I love, love, love this. All right, now, how do we get this in the hospitals? How do we get people to actually do it? That's really the feat. Like
Yes,
the feat is the education piece, is getting this into hands and then getting hospital staff essentially getting their buy-in. But I think this is going to be pivotal in that because that cover letter lays out exactly what you're expecting. It could be something as simple as like, we have done a lot. We have done extensive research into our preferences about our birth. We really trust my body and we value your opinion.
yes,
We appreciate you respecting our autonomy and look forward to birthing our baby with you. That's it. That's all you're doing. And then
absolutely.
please see our preferences on the next page and feel free to ask us about anything that you'd like, you know?
Absolutely.
Oh, I
Absolutely.
love that.
And I love that you said that because I feel like when there is a value of one another, even, but
Yeah.
not just the patient's values, but valuing the providers and where you've chosen to give birth. Like you're there for a reason. Now, yes, for some people, they have limited choices and they just got to go where they got to go. But more often than not, I think people choose this location for one reason or another. So you value them already and their expertise, their education and experience, right? And so coming in with this neutral, hey, I'm so happy to be here. These are the things that are important to me as far as our communication while I'm here. Those preferences are on the other page. And if you happen to see one that's like trying to fly out the window, keep me posted on that because I want to be able to prepare my mind for that. If we might be heading toward a C-section for some reason or another, let me know so I can start to chew on it a little bit. But if you're a worrier, tell them. If you see one of these things flying out the window, please don't mention it to me. I don't want to know. I want to keep staying as focused as I can until I know the path has to change. So we're individualizing this to the person's specific interest. They're what works for them. Because if there's a highly anxious person and we tell them, hey, we're seeing signs that we may have to go back for a C-section, not emergency, but the baby seems to be in an asynclitic position and it's not really helping the cervix to dilate. So we're going to try a few things, a few more hours or whatever. But I just want you to know that's what we're thinking. For some people, that's so reassuring and calming. And they're like, okay, spitting
Let's
babies or
do
whatever.
it.
They're going to bring up all the magic. And for others, that would just put them in a tailspin of anxiety and
Yeah.
stress, and it would be horrible, right? So we've got to find out what works best for them.
Mm.
And then with this time out, having a timeout at the end of your birth and having that time for debriefing before you leave that day of discharge. How sweet. You think about a regular conversation with a friend or your spouse and how easily things can get misunderstood. And we're just talking face to face. We're not dealing with all these hormones and this stress of bringing new life into the world. Imagine just the taking that pause at the end so that we can have this conversation. So I know why I got an extra bag of Pitocin, or I know why you chose to give me the shot or the stuff in my rectum, or why
Whatever
did
it
we
is.
really need to use the vacuum? What was the
Yeah.
medical reason we had to use that vacuum at the last minute? I didn't understand then. So can you help me understand now?
That's a powerful sentence. I didn't understand in the moment. Can you help explain it to me now?
Yes,
Oh,
absolutely. If we give them a chance to understand, that helps them understand how we've cared for them, why we made the decisions we made. It should be told in the moment, and we may have told them in the moment. But
mm-hmm.
do you know how many times somebody forgets something because they're in such a high stress moment? They
Totally.
forget, oh, yeah, they told me the baby's heart was dropping and wouldn't come back up.
Yeah, it was all a blur. Okay, you've touched on this just a minute ago, but you knowing the type of person you are and the way that you like to and receive best information is a deep topic, and not everybody is ready for that conversation, Dawn, and not everybody's going to do the work before birth. And you know what? It almost always comes up in birth. Like, you're better off doing the work. If you can know yourself, then you can actually prepare the people around you to best support you. But they can't know things about you that you don't even know about yourself. And I always remind people that it is actually kind to others to set them up for success by doing the deep work within yourself so that the people around you do know how to best support you, right? And I'd love to dive into that. What's in your head about that? Because you just hit on a sore spot, I think, for a lot of people where they're like, oh my God, I don't want to do that work. It's scary. It's hard. It's going to bring up emotions I'm not ready for, prepared for. But sister, it's coming up regardless in birth. It almost always does.
Yes, and I appreciate you speaking the truth about a hard conversation there,
Yeah.
HeHe, because it is hard. And the older we get, the more work we do, the more we realize, oh, that would have been so much easier if I'd have done
Yeah.
that. I don't know anybody who wishes they would have waited. I tell my kids all the time, my kids are in their late 20s, early 30s, and I tell them all the time, I'm so proud of you for doing work now that I'm just now doing in my
Yeah.
50s. So many more things in life are going to be so much more beautiful because you're doing this work now. And I think the truth of the matter is we have to consider the time we have, right? How much time before I deliver? First of all, I would recommend considering making sure that you have enough support. Your partner, friends that are close enough to you to call you out on your BS, and
Mhm.
close enough to tell you when they're worried about you.
Yeah.
Don't just
Yep.
have friends who are fair weather friends that are going
Yeah.
to tell you what you want to hear. You want to have people who are going to speak truth into your life. And then if you are open to it, making sure you have established a relationship with a counselor. And you could even let them know, you know what, I'm doing all this birth preparation and I'm realizing some things about myself. So I want to get established with the counselor before I give birth, because I am learning how much of my past, maybe my childhood or past traumas, are impacting my decision. If all your choices are made out of fear,
It ain't
that
gonna
is
work.
not going to help you flourish. No, you have it won't. And ask me how I know.
Yeah.
You know,
Lived it.
lived it. Fear was, as a matter of fact, just this last week, I was telling my daughter, it makes me so frustrated how much fear played a role in the decisions that I made in my life, and
Yeah.
how that's not a way to live. And so when we're first looking, let's say, okay, you're looking at a birth plan and you come across John's pivot plan and you're like, ooh, I have to know, how do I explain this stuff to others? So I need to know how I like things explained. First, I want you to think about going to a restaurant, okay? And this is just unfolding here. Going to a restaurant and you have a menu before you, okay? Are you going to keep changing your mind every 5 minutes the longer you sit in front of that menu and they don't come take your order? You're going to just keep changing because, oh, everything it just looks good. Oh, goodness. Is that the type of person you are? Are you the type of person who just gets the same thing every time they come into the restaurant because they're comfortable with it? So we're going to go with the comfort. And I could be either or of those. It
Mm.
depends on the day. So when we're talking about permissions, I would ask myself, how do I feel when somebody comes and touches my body without permission? Somebody just comes and grabs me and hugs me. Some people love it. I'm a hugger. Somebody comes up and grabs me and hugs me, I'm all for it. Some people, not so much. They need their 3 feet or whatever. So how do you feel? And then that's how you would be with permissions. How would I feel? And I think these are questions that we're going to be covering during the pivotal birth workshop that we're doing at the end of June. So how would I feel if a nurse came and gave me medication without telling me what it was for or asking me or anything? Like, how do I think that would make me feel? Okay. So this is going to help you know how much permission you want. Do you want all the permissions? Do you want most of the permission, or you want minimal permissions? Because some people are like, yeah, check my cervix, I don't care. Others
Yeah.
are like, don't come near me with a glove. Don't even put the glove on until you've talked to me. That's rude.
Yeah.
You're assuming
Yeah.
I'm going to say yes.
That's me. I'm like, don't even assume you're getting in here, buddy. You better tell me
Mm,
what we're doing while we're doing it. A good reason, too. Don't BS me here because I'm going to be mad.
yeah.
Okay, so you were mentioning like I could be both of those things. That's really hard as your support person to try and have to like guess, should I interrupt and say that we could move positions or will I just get yelled at? What is the right move there for support people? Should you be asking questions? Should you be saying like, are you good here or do you want to move positions before you just say like, well, we could get in the hands and knees, we could get on the birth ball, we could get back in the tub. How do support people support someone who is a little unsure how they're gonna feel in the moment, which I think is most first-time moms.
Yes, absolutely. And my recommendation, and I tell this whenever I'm in the hospital as any role, nurse, midwife, or not midwife, nurse, doula, I'm
Doula.
speaking the future here. Nurse, doula, family member, don't ask questions. Please don't ask questions, especially if somebody is having a contraction.
Mhm, mhm.
Don't ask questions. Kind of keep track. It's been about an hour in between contractions. You say this. It's been about an hour since you've gone pee. So after this next contraction, let's get up to the bathroom. She can always say no, not yet. It's easier for her to say no to something than to think, do I want this?
Oh, that's a really good
So
point.
same with water, ice chips. She's finishing a contraction. Here's your water, or here's some ice chips. She can say no. That's way easier for a laboring woman than to answer, do you want water? I don't know what I want. I don't even know who I am. I'm not even in this realm right
What is
now.
happening to me?
Who are you? Yeah. And then the same is true for positions. Keeping track of the positions and how long she's been in one position. She's been doing this for 5 contractions, 30 minutes or so, whatever. So in between contractions, you let her know, okay, you've been in this position for a while. After this next contraction, this gives her time to get her head around it. After this next contraction, we're going to go over and sit on the birth stool, or we're
Mm,
going to start walking in the hall, or we're going to pee, or do you see what I'm saying?
yep.
She can always say, no, not this time. She always has that right, and you honor that. You don't dog on her. You don't feel disappointed in her. You don't get offended. If you're rubbing her back or giving her some counter pressure or a hip squeeze and she's stop, you don't take that personal. It's not
Sure,
about you. It's just not working right now.
sure.
It doesn't mean it's not going to work in 20 minutes or in 2 hours, but right now, that's not going to work. And you
Yeah.
just don't take it personal. So my encouragement to all support people, don't ask questions, offer what is you guys have discussed ahead of time.
Mhm, mhm,
So that
mhm.
peeing every hour, offering water and ice chips in between. And she might just be like, water. She might tell you when she wants it. But if not, offer that in between every couple contractions or so. Unless you said, we're going to offer it between every contraction, just to keep her really well hydrated. Keeping her hydrated and keeping her to that bathroom, sitting on that dilatation station is so beneficial. Like we
Yeah.
want to keep doing that. So doing that is my recommendation. And then when it comes to being included in that conversation, if you guys talk about all this ahead of time with the childbirth classes, please take childbirth classes. Please.
Yeah.
I know you can get free stuff, so much free stuff on the internet, and I think it's great. But having some structured stuff where you can actually search up good quality information is so vital. Doing it together with your support team is even more vital because a little bit of exposure to this and then rewatching the ones that might have either freaked you out. Let's say the interventions one freaked you out when you learned about them breaking water, or internal monitors, or all these things, and it really freaked you out. You can watch it a couple times. So if any of those ones happen, you don't feel quite as freaked out about it.
Yeah. Yeah.
You
It's
get
all
that.
about preventing that spiral, right? Like we're trying to prevent the unexpectedness that is like, oh my God, I didn't expect this and now I'm spiraling.
And we don't expect anybody to memorize any of the childbirth
Oh,
classes
no.
at all,
Mm.
but we do expect them to get a little exposure so it doesn't send them into a spiral. So it doesn't feel like somebody's hijacking their birth plans or preferences or their pivot plan. So if you have established this communication, you've shared the preferences that you highly value, man, imagine how much more likely you're going to have a positive birth experience.
Yeah. Yeah. Okay. I want to wrap up with some really heart to heart conversations. I want to pretend I'm going to give you some different scenarios of different pivots that we might encounter. And I want to hear advice from Nurse Dawn, Mama Bear. I'm here to help you with whatever you want. We're going to get you the birth that you are meant to have, even if it pivots so many times. All right.
Okay.
So,
Mm-hmm.
for someone who has just encountered some sort of diagnosis in their pregnancy, whether it be gestational diabetes or preeclampsia or hypertension or cholestasis, anything that they were not expecting, what do you have to say to them about pivoting, accepting the pivot that's going to
That
come
is,
their way?
yes, that is wonderful. So my first recommendation whenever I have people come to me that have had a diagnosis toward the end of a completely normal pregnancy, everything was going
Yeah.
great. Oh my gosh, I just
Yeah.
got side railed. Is mindset. We have to look at your mindset surrounding this and everything because really when it comes to birth, what you think of what happened is way more important and carries way more weight and stress than what happened.
Yeah.
So, say we've got this cholestasis diagnosis, you're itchy as all get out, you're going to have to be induced at 37 weeks. You didn't want to be induced. So, my first recommendation is let's work on your mindset every single day. And first, that's just going to start with sitting and meditating, trying not to think and spiral negatively. Okay.
Mm-hmm.
So if you
Mm-hmm.
just start with that 5 minutes of sitting still with your feet on the ground and breathing and just focus on your breath. And when you're distracted with your thoughts, not if, because you will be,
Yep.
when your thoughts get distracted, gently, without judgment, bring your thoughts back to your breath. And that's going to happen like 100 times in 5 minutes, maybe 1,000, depending on how fast your thoughts run through your brain, right? And a lot of this is from John Kabat-Zinn. I don't know if you're familiar with him. He wrote a book called Full Catastrophe Living. It
Oh,
is why I can cope with my chronic illness and chronic pain.
oh my gosh.
It's the only reason I'm saying. And so basically, you just imagine these thoughts that are running through your mind as a cloud. The sun is still up there, the sky is still blue. This is just a thought, and it's clouding the truth right now.
Oh,
And the truth is, it's going to be okay. We're going to work through this. And so you just gently, without judgment, you bring that thought back to your breath. And it's going to do so much for you. It's going to make your thoughts more positive. It's going to make your inner talk more positive. You're going to be gentler with yourself. You're going to be gentler with other people. You're not going to jump to all the negatives constantly. And it's definitely mindset. And if you just start with that 5 minutes and then work, Bridget Taylor, YouTube, she has so many
yeah, she's
wonderful,
amazing. Yeah.
wonderful mindset videos. Totally check her out.
Yeah, she's awesome. Okay,
Yes.
what about someone who has made the pivot and they weren't really excited about it. It wasn't their plan, but they ended up getting the epidural. It was the right choice for them, but they're just a little disappointed in themselves.
Yes. So again, here we got to think of mindset, and hopefully somebody on your care team or on your support team is going to sit with you and just listen to you talk through it. Because first of all, getting it out is helpful, right? I'm just so frustrated with myself. I was planning on not getting the
Mhm.
epidural. And then I'm just so sleep deprived from all this long induction to get me where I'm at. And I just needed a little bit of sleep. And so they basically will talk themselves to a place of peace.
Mm,
And so listening is
mhm.
what the support team can do. And the hard thing as the support team is to be like, yeah, but, and try to talk them off the ledge. They know the truth within themselves that it was the right thing to do at that time. And listening to their whole spiel and how they feel is going to be helpful. And then saying something along the lines of, I'm going to be so excited when you see the silver lining, because I know this is a
Mm,
cloud for you right now, but there will be a silver lining.
mm.
So I'm here for you to talk anytime you want. You just let me know.
That's awesome. Yeah, I think I always like to remind people that an epidural is a tool that we have. And sometimes we have to dig deep and use tools that we weren't expecting to use. But if it was the right choice for you, then I hope you can get to a place where you don't have any judgment on yourself, because I don't think anybody else in your experience has judgment for you. If they do, that's not okay.
Yep.
Nobody has room to judge anybody for their pain relief. But really, that self-judgment about the epidural, for me, it's just don't even bother. It was the right choice for you. You did what you needed to do with the tools that you had at the time, and you should feel proud of yourself. You grew a human, you birthed a human, you have a tiny human you're keeping alive. That's a big feat. Okay, the
Right. And
last pivot.
we wouldn't shame anybody who's using a screwdriver to put in a screw and they hit a stud
Exactly.
and they use a drill instead. We would never shame.
Exactly. Oh, what a good analogy. Oh my gosh, you are full of good analogies. That one is really good. Yeah, no, you're right. We wouldn't judge people for changing tools to get the job done. And that's all we've done when we've chosen an epidural. Oh, I love that. Okay, the last pivot I want to talk about is probably maybe the heaviest one, but an unexpected C section, when your birth ends in a totally different way than you had ever envisioned. Maybe you hadn't even considered it because you were just very laser focused on a vaginal birth. What do you have to say to those people?
So the cesarean is another tool.
Mhm.
Okay. And so, just like we were talking about people not wanting to do that inner work to understand what it is that they want or how they work or how they operate, when it comes down to feeling like a failure for the epidural or for the C-section, when people have super strong emotions about that, it's usually not even related to that particular thing. It's a past trauma of some sort
Mhm.
that's being expressed in this moment in time. So they feel like a failure. So how old do you feel? Were you in gymnastics and you fell from the bar and you felt like
Yeah.
is this a that thing? Is it another thing like that? But if you have your pivot plan and you're communicating like that with your team, and then the next team for the next shift, and so on and so forth, you're establishing this mutual respect and communication amongst each other. Your team is going to know that you want them to talk to you in this way. I want to know if you see this cesarean on a horizon so that I have time to process that this is going to have to happen and know that it's going to have to happen and it's a medical reason. It's not because we had a failure to wait, or it's
Yeah.
not because this, that, or the other, right? And if you've had time to chew on it, or if they're like, you know what, you've been pushing for 3 hours, we're not seeing the baby come down. And so we are concerned that baby is not going to be able to come down and out without either a vacuum assist or possible shoulder dystocia. And so we need to talk about these risks. So you and your partner can talk about, what does this look like? Is the vacuum extraction worth trying? Or should we opt for a cesarean? Now, is it that you failed? No, it's just another tool to get the job done. And as long as you understand the risks, if you want to understand the risks. Not everybody wants to know the risks,
I
benefits, and
know.
alternatives. They
I
don't.
cannot understand that. I support it just fine, but it is always a place where I'm like, "Wow, I just could not imagine choosing that." It's not a problem for me. Honestly, it's less work for us, right? Because they
I
don't
know.
wanna have that discussion, and so I'm like, I totally respect that. But as me, as a human, type A, Aries, 3-wing 2, Enneagram, like, I am just like, "Give me all the information." So people who are like, "I really don't wanna know I don't wanna know any information. I really just wanna know, like, the lowest risk option that's gonna be the safest or the quickest or
Yes.
whatever it is." I'm like, "How do
Yes.
you how's your head not exploding with a million questions? That's crazy."
Yeah, and some people just have so much trust for the medical field. That's how they were
Yeah.
raised. And so they rest in that. And you know what? Whatever brings you peace,
Mhm.
if it's knowing all the information or just giving you the one option, whatever brings you peace, because at the end of the day, you're the one who should be at peace.
Yeah.
And so if you end up going for a C-section, your team should be communicating with you on the level that you need. We're going to sit you up on the table and scoot you back so you could do your spinal or talk you through to the level that you need. Or you might just be that, do whatever you got to do. Don't talk to me. I'm just
Yeah.
going to be over here breathing through this contraction. And so, gosh, imagine to be honored in that way as an individual during your birth experience, even if it doesn't go the way that you want, just how much less stressful that would be for somebody,
Yeah, for sure, for sure. This
you
is
know?
going to do so much for that relationship between the patient and provider. I just see like trust being built. I see that restoration of, I guess, the broken trust that we've seen over the last couple of years in the healthcare system. I can see that being restored. This is so sweet.
It's very exciting. And I feel there's just sometimes things happen where you just feel moved in your spirit. And this is one of those times. Gives me peace in my
Yeah,
spirit for the heaviness that I've been carrying around for these last few years about the families and their experiences. Just sitting and mourning that and meditating on that. And this came along, and I'm just like, whoa, this is
yeah,
amazing. And what a gift to be able to give other people and to be able to share with nurses and doctors and doulas and everybody to be like, let's do this for everyone.
yeah.
You'll see more and more of this coming out in the next few weeks.
I love that. I want to hold space too for our healthcare professionals because it is hard. It's got to be hard to be expected to change your communication style per patient. You have one, two, three, sometimes patients at a time, all maybe requiring different communication styles. Each day you come to work, it's a different set of communication styles, and you only see this person for 8, 12 hours. That is tough. I want to recognize that. And I know that nursing is heavy, so sometimes you're not gonna be in the headspace to do that, and that sucks.
Mhm.
I don't know that there's a good answer for it. I don't know that there's a good medium for that other than improve staffing in our hospitals, treat our nurses better.
Wouldn't that be grand? It's important to know that nurses have been trained to do that because we've been
Oh,
taught to do that with all the doctors that we communicate, all
oh
the
my
OBs,
god, I didn't even think
all the
about that.
anesthesiologists, all the pediatricians, all the respiratory therapists, all the lab people, our supervisors, the traveler nurses. We have been trained to communicate differently with different people our whole careers. And even though our patients aren't all going to be identical, if the premise is the same, I need to know how much information you want, and I need to know how much
Mhm.
permission. The permissions and the options and those kinds of things, it's going to be an easy flow once they get the hang of it.
Yeah, yeah.
And it is a hard thing to do as a labor and delivery nurse that you're communicating with doctors and nurses and other ancillary staff. You're communicating with the patient and then their family and support people, right? So we're really used to being mindful of who we're talking to and how we're talking to them.
Yeah. Wow, that's so comforting to know. Oh my gosh, this was so amazing. I love angel numbers and we're wrapping up recording at 4:44. So this is just so good energy. Okay, Dawn, you teased it just a minute ago and you said more is going to be around this topic and these discussions. Where can people find those conversations and connect with you if they want to learn from you?
Absolutely. So I can be found at Pivotal Birth on all platforms. So I'm largest over on TikTok, but finally Instagram is growing. But I also am starting with the YouTube and Facebook and all that good stuff. But my website is www.pivotalbirth.com. Info at Pivotal Birth is how you get a hold of me as far as email goes. But I will be doing a Pivotal Birth workshop that will cover in depth this pivotal plan at the end of June, and the link is in my bio. You can click on the link and sign up for it. I have it as a pay what you can because I have a soft spot in my heart for everybody.
We love that and we love you. And I'm very appreciative for you coming on the show and sharing your wisdom and sharing this really, no pun intended, but pivotal key element in really being prepared for birth in the hospital, home birth as well, but specifically in the hospital where we really do want to in having those better communication skills with their medical staff in order to improve their experience and their outcomes. So this was awesome. Thank you so much. I
You
appreciate
are
it.
so welcome. Thank you so much for having me. It was such a pleasure to talk with you.
Yeah, absolutely. All right, you guys, I will see you in the next episode. Until then, connect with Dawn on social media. You can find me at Tranquility by HeHe or at the.birth.lounge. And until then, go download the Birth Lounge app where you can find evidence based childbirth information and data driven postpartum support directly to your phone. Until then, bye, y'all. Thank you so much for tuning in today. I truly do value this community and I love hanging out with you. You deserve to have a birth that you love with a provider that values your autonomy and respects informed consent. It's an honor to be your go-to gal when it comes to preparing for your baby. If you found today's episode helpful, share it with a friend. Share it with someone who could use evidence-based information to help them have an informed and confident birth. I'd love to hear what you have to say and read your sweet words. By leaving us a review, you are helping other expectant mamas and their families find the podcast so that we can reduce birth trauma and improve maternity care in the U.S. one birth at a time. If you're interested in joining the Birth Lounge, go to thebirthlounge.com. If you want to connect with me on socials, you can find me at Tranquility by HeHe on all platforms. Until next time, stay educated, stay supported, stay confident. Bye.